Hi, welcome to Ketobiography. I'm your host, Robyn. My guest today is a board certified family medicine physician and metabolic health practitioner who has spent her career helping people reverse chronic disease through lifestyle change. She's a founding member of the Society of Metabolic Health Practitioners, and she's just published a memoir about something she never expected to write: what happens when an evidence trained mind runs into something it can't explain away. Please welcome Dr. Laura Buchanan to Ketobiography. Hello. How are you? Welcome. So good to see you. All the things.
Thank you so much. I'm thrilled to be here. I'm doing great today and hope you are as well.
Oh, doing good. Trudging through, I guess, is the best way to say it, but somehow, some way we'll find it to the other side. So I have just been so excited to have you on. I've been wanting to ask you on for a long time because me personally, I have like all these books back here about like menopause health, and I'm taking nutrition network courses, and you were one of the instructors on that particular course. So I'd love to talk about that. But before we get there, I really just want to hear this journey. I mean, you're a doctor, you I'm sure trained in a very regular, normal, the way doctors train kind of way, and then you find yourself at toward health, doing metabolic health work, and I'm assuming there's a little opposition there with your training and how you actually practice. And then this goes on to a much greater story, which I want to definitely talk about at the end. This story of your past year and a half, this part of that journey. So I'm just
Yeah.
going to turn it on over to you to share all that.
Well, thank you. And please feel free to jump in because I'll start kind of my background that got me here and kind of this metabolic health journey, I'll say. So growing up, I love sports. I played soccer, tennis, ran track, and in college I continued to play soccer on the club team, and then I was training junior professional tennis players. And during kind of those high school years, I was watching my grandparents age differently on the two sides of the family. And my granny, she was aging successfully. She was thriving, playing tennis, and into her late 80s and lived into her last decade. She was doing it all, and into her mid 90s. And it was really through her lifestyle. It was how she was living, what she was putting in her body. And I was like, I want to help people age like Granny did. So, and then on the other side, I saw my grandfather, who I love. He was having complications from diabetes, dementia, using insulin, and just some of the unfortunate complications you see with diabetes develop. And so it was a stark contrast in the quality of life over that last decade. And that was, again, those through lifestyle. So going into med school, I actually we had a 2-week nutrition intensive, and you learn the classic things of, oh, vitamin C deficiency causes scurvy, or thiamine deficiency is associated with wet beriberi or dry beriberi. So these types of things, they're actually fairly rare, not practical to help the patient in front of me use nutrition to improve their life, reverse chronic disease. And so it was just lacking. And so I was super interested in that, and I did my own deep dive. I found Nina Teichol's The Big Fat Surprise, Jason Fung, the Low-Carb MD podcast when it first came out. That was when I was in medical school, and I was listening to that. And I was hearing people get off of medications, reverse their disease with low carb. And then with Nina Teichol's book, I mean, I myself actually avoided red meat for almost a decade because I, was kind of buying into the dogma. It's unhealthy. It's not good for you. And here I was eating more of a higher carb, more standard American style diet, and found myself with an A1C in the pre-diabetes range while playing college sports. So clearly there was a mismatch there. And as again, my eyes were just kind of opened through my own deep dive, and I got very frustrated at the medical system. And I got my own continuous glucose monitor for the first time in my 4th year of med school. And I, at that point, had started eating lower carb myself. And when I got the CGM on, I saw my sugar spike into the 180s. And I was like, what is going on? And it was these healthy oatmeal bites that were super high fiber, low net carb. And I, bought into that, again, kind of trick that the food companies like to do, say you've got low net carb and yet the body absorbs the carbs. And so anyway, I learned a lot using the CGM myself for the first time back again at the end of medical school. And so then I really transitioned to low carb and being able to use the CGM to, again, remove some of those processed things that I thought were low carb and stick more with whole foods. And going into residency, I said out of the gate, I am going to practice low carb because I've already been hearing about all these amazing things these docs are doing. Eric Westman, Mark Cucuzzella, Tro, Brian, and I had the actual, it was a great honor. I got to go shadow and work with Dr. Westman for a week in residency, and Mark Cucuzzella, Dr. Mark Cucuzzella is amazing. And those were, the impact they were having on people's lives was just incredible. Like that, those 2 weeks were so powerful. And I, gleaned some ways to help counsel people, some handouts, and that. So again, I was through my residency, that's how I was actually practicing. And I was very blessed. Initially, like you mentioned, there was a little bit of opposition with kind of the way I'm practicing in standard medical care. I can remember the first time I had a patient come in with an A1C above 10. Typically, you should start that individual on insulin. And I said, hey, we could start you on insulin like the guidelines are telling me, or we could change your lifestyle, put on a CGM, and let's see what we can do with eating keto. And the patient was super excited, said, let's eat keto. I do not want to use insulin. And my attendings initially were like, what are you like? I don't know if this is a good idea. I'm like, no, look, I'm going to do it safely. We're going to make sure we're going to check a C-peptide. Their body's producing their own insulin. We're going to watch it with the CGM. And if their sugars don't come down quickly, we'll use medications. But the patient did phenomenal, dropped their A1C dramatically. Their sugars on their CGM dramatically improved. So through several encounters like that, I stopped getting pushback. And in fact, the faculty, and there's several people that got very interested. And some people I know even adopted low carb and would use low carb for their patients or recommend low carb for their patients after that. And so that was it was a wonderful work environment. They were encouraging and allowed me to really develop my skills in that standard medical model.
Yeah, that's actually quite amazing to hear. We hear the horror stories, I guess, maybe from doctors who are perhaps like a generation above you, the ones that were teaching, and they're like, nobody taught this. I only have 5 minutes. But you actually went in with a little bit of understanding. It's actually quite refreshing to hear that you were able to practice those things, and maybe there were some questions, but they let you go with it and see, and perhaps even start making a change. And I feel like that's how it's happening, right? Like the younger people are coming up, and it's starting to change the minds of the ones who are kind of, I don't want to say dogmatically in this mindset, but that's what has been taught for so long.
Yeah.
And it's hard. I mean, you got to unlearn so much stuff, and then have some young buck come up to the ranks and be like, no, let's try another way. I could imagine that there was a lot of pushback there.
It was, and again, within my department in family medicine, it was really great. There was some not as great encounters in outside departments, and I think I've told this story. It's just it really hits sadly, but I was working on the inpatient pediatrics ward, and a 12-year-old was coming in with a brand new diagnosis of type 2 diabetes, A1C, and maybe it's 13, A1C of 12. So blood sugars are way out of control, at 300 average. And when he got admitted to the hospital, and it was mostly for education, try to get those sugars coming down, in the morning time, we fed him, as the hospital, pancakes and syrup. But it was a sugar-free syrup, right? Well, his sugars skyrocketed, and what did we expect? So we had to give a lot of insulin to cover and bring down those sugars to a safe range. Well, during rounds, I suggested we put him on a low carbohydrate diet so we did not have to use so much insulin to normalize his sugars. And the attending, who's the head of the team, so the team has residents, fellows, they've completed residency and are now doing specialty training in endocrinology. and medical students. So it's everyone's in the room, part of a team. We're all kind of talking, figuring out how we're gonna help the patients. And he says, well, what are you going to feed him then? I said, well, we could feed him eggs for breakfast. And he says, so you're going to cause a heart attack? I said, no, I'm going to give him some fat and protein that are nutrient dense foods. And, if we don't want to do eggs because the cholesterol, if that's, your concern, well, you can find some other things that are still lower carb, some egg whites and something else. And he said, so you're going to kill his kidneys with all the protein. And I said, well, respectfully, his sugar's in the 300s. Diabetes is the biggest cause of kidney disease and heart disease. So it's really these high sugars. And we went back and forth for a little bit, and it was very quiet, very awkward in the rest of the room with nobody saying anything. And eventually, I said, okay, I'll whatever you tell us, I'll follow suit. So we let him eat his carbs, and we dosed higher amounts of insulin. And that was the education he got at the hospital, that you can eat what you want because we can cover it with insulin, basically. And so there's still some of that. And, when you talk about the old dogma of the cholesterol causing heart disease, and the cholesterol from food increasing blood levels, and then also the high protein and kidney disease, even though there are plenty of studies, and that could be a whole, podcast on its own, talking about the studies that show that's really not the case. There's not good data to suggest actually that red meat causes heart disease, or high protein diets cause heart disease or kidney disease. It's actually the opposite. When you look at populations with type 2 diabetes, higher protein intake is associated with lower kidney disease.
Well, you're reminding me of the conversation I had Allison Coughlin on the show a couple months ago, and she's the mom from the cholesterol code with the story of Johnny. And my heart just broke for her. How many parents get this news of let them eat what they want because they're kids and it's okay, and you don't want to ruin their lifestyle, and it's gonna give you a heart attack, all that whole business, just exactly what you described. But as a parent, she's like doing math that she didn't expect she would have to do, waking up in the middle of the night and checking, and having these highs and these lows and all of these things to suddenly manage. And like, just how scary that is, when there could be a better solution to manage. And he's a type 1 diabetic, so to be able to manage that and keep that level baseline just by dropping the carbs, it seems so easy, but it's just hard to get that through. I think it's getting better, but it's hard to get it through.
Yeah, 100%. It is definitely getting better. We're seeing that ship slowly turn. I think the new dietary guidelines for Americans is a good example of that ship turning. It's just going to take time for especially I think doctors that went through training a lot longer ago to adopt or to retire, unfortunately, is that sometimes is the case, actually, for that to pass on that ideology.
Yeah, unfortunately, that's true. You have to like refill from the bottom up, and hopefully there's more med students like you coming up too that are willing to speak up and have some knowledge of what a low carbohydrate diet can do. And hopefully there are some people in between that when you do speak up, they're like, yeah, I kind of have heard this before, let's give it a try. So I guess you win some, you lose some. You had some that they were happy to give it a try and manage, and then you had others, and you got to be thankful for the ones that allowed you to try.
Yeah.
So I definitely want to move into, well, first of all, Westman and Cucuzella, that's just an amazing combo right there.
It was phenomenal. I'm pretty sure I wrote it down. I haven't looked at it in a second here, but I think during that 1 week with Westman, with the follow-up visits he had, it was close to 1,000 pounds of weight loss in the patients he was seeing. And I don't know how many countless medications deprescribed, but it was truly a remarkable week. And I think, he still lets residents and med students shadow him. So I encourage anyone listening that's got that opportunity to reach out. I was so amazed when I sent him an email and he answered and said, sure, come on over. So it was forever grateful.
I think that's a little bit of paying it forward, right? He was able to go and visit other offices, so he'll let people in. Super nice guy, just like way down to earth. And I'm sure that was an awesome experience for you. And while you're still learning, like, just being able to have that experience. I hope he takes one more. So if you're listening and you're thinking about where to go, give him a shout. So,
Definitely.
yeah. So, and then I had Dr. Kukazala on a couple months ago as well. And, what he's been doing, especially in the type 1 community, how he serves the type 1 community, and then the underserved communities that he works with. It's just, there's a lot of amazing people out there doing amazing work for sure.
Yeah. Yep.
So now let's transition to how you end up toward health with practicing with Dr. Tro and his amazing team.
So, and I think actually Mark Kukazela, I have to thank for it in part, but it's I would say there's a lot of coincidences, which now I might call them something a little bit different than coincidences that than previously. But I was actually I was attending a previously called Low-Carb USA conferences, now Symposium for Metabolic Health in Boca, and Tro was presenting, and he had to stay home and was presenting virtually because he got COVID, unfortunately, but he was okay. So he still did his presentation. And I went up to this stand after to ask a question on the microphone, asked him the question, and he texted Doug, who runs the conferences, and said, "Hey, tell her to call me." So I called Dr. Tro, and I was kind of, I'd been listening to this podcast since medical school. This was one of the people who really shaped how I was practicing medicine. And I was like, wow, I'm going to, call him. And so we spoke, and he said, come up to my clinic and shadow me and, work with me for 2 weeks. And so I did that during residency, actually, and we hit it off. It was amazing. The way he advocates for his patients, and he cares so deeply. It was really, again, Mark and Eric are phenomenal as well, but all of them it was a different way to practice medicine. And it was so exciting. And when afterward, he's like, come work with me when you finish residency, I could not believe it. And I was like, all right, we're doing this. And so I did some urgent care a little bit on the side as I was starting to build up the practice, but I've since stopped doing that. And I've never been truly in the standard model, because I joined straight from residency through an amazing segue of events. And I'm thrilled. I couldn't imagine doing it any other way. We've got 1.5 hour initial visits, 30-minute to 1 hour visit follow-ups. So you actually, you get to know people, but you get to really try to dive deep into what's going on. What can we try to fix things? And it's just, again, it's much different than 15-minute medicine, as I like to say. In the standard model, I have friends who are, they're wonderful docs, but they are stuck in 15-minute time slots because that's what the medical system, their organization, requires.
Yeah, it's so unfortunate. What was I just watching recently? It was like, most of the doctors are working for a company and have to toe the company line. So you thankfully never really had to do that. Well, your company line is, let's try some alternate things. let's try low carb. I get it all. I did all this stuff. I did all this work. I know how the medicines work, and I'm willing to research it and all that stuff. But hey, we have some other options for you too, which is refreshing. I happen to be a patient of Tro's at that time. So you had sat in on one of my visits back in the day. I don't know if you know that, but yeah. So I met you back in that time, so long ago.
Yeah, isn't that amazing? So that was back 2021 or 2022.
Yeah, somewhere in there. So
yeah,
it's like a small circle moment, maybe not the full circle moment, but at least a small circle moment.
Yes, it's like an Apple Watch. There are so many circles that connect. Actually, it's pretty remarkable.
It sure is. And I do want to get into that, because I think that will lead into this book that, if you're sitting here, it's right behind me. I mean, if you're watching, it's right behind me. If you're sitting here, who is me? Yes, it is exactly right. Anyway, but I wanted to, before I do that, I want to talk about, like I said, right in the beginning, that I had taken nutrition network classes, and you were an instructor there. So, what are the things that you're most passionate about as a physician?
So the metabolic health, in which metabolic health ties into so much, right? I say metabolic health, and metabolic health is mental health. They are the same. And if you look at diseases of poor metabolic health, that actually basically hits almost anything you can think of that pops to mind: dementia, heart disease, anxiety, depression, fatty liver disease, PMOS, previously called PCOS. I mean, the list just goes on and on. Migraines, and I so love focusing on metabolic health and helping people change their dietary habits, their lifestyle, because the quality of life improvements and changes is beyond amazing. And Eric Westman, he always says this, and it's great. It's so unbelievable. It's unbelievable. Like, that's, you see so many things get better. I'll just quick aside. So we published one paper on a cohort of 50 individuals where this was last year. We had almost 100 medications stopped, only 8 medications started, over 40 pounds of weight loss in the year. But beyond those, which is, you know, super fun to deprescribe that many medications, the individual in front of you who is now able to fly on a plane without a seatbelt extender, or able to go to the high school football games again because they can now fit in the seat that they couldn't fit in before, and able to ride a bike and go to Disney with their family and actually kind of keep up with and really spend the time with their family versus sitting on a bench, letting their family go and do things while they sit there. Like those, it's life changing. And then the same thing on the mental health, you see just some remarkable stories. And I've shared, you may have probably talked about this study on the podcast, but I just think it's such a powerful study. And now there's more even randomized trials looking at bipolar, schizoaffective disorder, schizophrenia, another one that Eric Westman was on. But 27 individuals who completed a ketogenic diet that had previously been on multiple psychiatric medications, and the medications had failed them. They were not adequate. They were not helping their symptoms. They were hospitalized multiple times. And 12 out of 27 of those individuals went into complete remission, which, I mean, that's just unheard of. And all 27 got better that completed the dietary intervention. 4 people, for different reasons, did not stay on a ketogenic diet. But all 27 that did. I mean, those results are just phenomenal. So,
and I believe that's the Danon, and Georgia Ede was on it. And is that study where they were inpatient in France?
Yes. Yep. Thank you. Yeah.
Okay. Mm-hmm.
Yeah. So
I don't know a lot of studies off the top of my head, but that one, you made me look good for half a second. So that's cool. But yes, it's fascinating. Or to even consider the word remission when it comes to anybody with a mental health issue is like completely unheard of, even on medications. Like, you just can't use that word.
Right.
And to be able to show it in 24 people, like, yeah.
Yeah, just absolutely amazing. And that just, I know I'm jumping around, but the word
you're good.
made me think of it. So in standard of care, diabetes, type 2 diabetes, the remission rate is about 1 out of 100. In Dr. Unwin's study, individuals who in their first year of diagnosis of type 2 diabetes, if they went on a ketogenic diet or low carbohydrate diet, 77% remission rate. I mean, compare that to 1 out of 100. It's just not comparable, right? And we had a poster we presented in Boca, and we had a diabetes remission rate. It was a small cohort of individuals, but 54% diabetes remission rate. So again, this is what the power of diet, changing your lifestyle, can do versus just jumping to medications to try to treat things.
That's a huge passion, metabolic health, because it is just that, like, it impacts so many different areas of the body, of the mind, everything. To have that as the passion is a pretty huge thing.
And thank you, that the word passion, now that takes me back to the original question. So that is definitely, yes, super passionate about that. And before we had our 2 kids, I have a 3-year-old and almost 7-month-old. My husband and I, he's also in this space, Dr. Matt Calkins, we would read studies and just research this stuff. I mean, this was just, we live and we love it. Now, what I realized as I was helping a lot of people with their metabolic health and doing all these great dietary changes, sometimes they'd still have these symptoms that I was not helping, and they still didn't feel good despite having a really good lifestyle. And typically it was the perimenopausal or postmenopausal woman that was having, sometimes it was hot flashes that were severe, sometimes it was vaginal dryness or joint pains that they've never had before. And so it's not just all of a sudden you say age, all of a sudden I have a really painful shoulder that I never had, a month ago. And so I realized there's another thing lacking in my training, and that was how to help and care for women going through the menopausal transition. And so I got my Menopause Society certification, went through, took the board exam, and there's one question I just have to mention. I got one question wrong on that board exam, and it was because I refused to put the correct answer, which was a low-fat diet, because I still stand by my belief strongly that the answer is not a low-fat diet. Anyway, sorry, sidetrack. But so I finished that training, and that was definitely very helpful. But I've continued to do kind of my own training and research on how to help women who are going through this menopausal transition. Because unfortunately, we as a medical society have, for the past really a little over 2 decades, done a huge disservice to women in general. And you might know kind of what I'm referring to in that basically with the black box warning that was on hormone therapy since 2003, women have, for a very large portion of women, have been neglected or offered hormone therapy that can dramatically improve symptoms. And so you had the WHI study, which we can go into if you'd like to, but pre-WHI, almost 40% of women were on hormone therapy, and post-WHI, less than 5% of women are on hormone therapy. And that was because
Oh, go ahead. You can keep going.
I
shouldn't have interrupted.
No, you're good. That was just because of all of the concerns that were brought out because of the WHI that really were unfortunately overblown.
Yeah, that stuff does definitely fascinate me, especially in this past year of my own, couple years of my own perimenopausal journey. The biggest takeaway for the layperson or the person going through it is that most doctors kind of treat you like you're sick, even though you're not sick. You're just going through a natural phase of life, and that there are supports available. But a lot of times you get a lot of pushback from, you know, traditional doctor, and it's infuriating. And then you can read up on stuff, and then you have the ones that are kind of quoting the errors that were found. They're saying that these things are right and you shouldn't take the medicines, keep the black box warning there. And then you read another one who's like, no, there's all these errors in this study. And it's just a really, like, if you're confused about it, read all the books, but you have to kind of take all the information and disseminate it. So it's very hard to find a physician like you out there that did take that time to kind of work it out and figure it out and know how to treat a human rather than a number, which is really what's hard to find, someone going through it.
Yeah, it's really unfortunate. Again, I think this ship is turning now that the black box warning has been removed as of last November. But I still currently am seeing new patients that tell me, they came in with their, 1 year postmenopausal, they're having some anxiety, some depression, some trouble sleeping. They really haven't actually had a lot of these symptoms except for the past few years. And their doctor's trying to put them on an SSRI for those symptoms without considering or thinking about the fact that it's because they just went through menopause and now their estrogen is non-existent, basically, right? And so there's actually studies that show, especially during that phase, if women are placed on hormones, anxiety and depression get better. It's not that they've developed anxiety and depression all of a sudden. It's that their hormones have shifted and the ovaries stop producing estrogen, and that's what's causing their symptoms. And so you can actually give back the hormones, and these symptoms get better. There is a study that showed that over 50% of women reported that their lives were given back to them by hormones. That's a pretty strong statement to make.
Yeah, well, since I started HRT, and it's been a little bit of a journey, but to have the lighting one hot flash off the other go away, I could tell you has been a huge relief. And I know my journey's not over yet, but just that in and of itself and being able to sleep through the night because I'm not dealing with those hot flashes and the corresponding night sweat, go for it. And if anybody out there is looking for an educated doctor in this space, go to Toward Health and seek out Dr. Buchanan because that she's gonna steer you in the right direction.
I
Uh,
appreciate that. Yeah, and when it comes to hot flashes, the average woman will have them for about 7 years. Some studies say a little bit longer. And so, the other things I've had women tell me before actually is my doc told me to suck it up because it'd be over in a year. I can't imagine ever telling someone to suck it up and
That's
deal with
good
hot
doctoring
flashes for
right
a year. Or get maybe they try an SSRI for their hot flashes. But I mean that's literally the quotes that people have told me, and I don't like saying that, but it's
Well,
what's reality.
I met someone recently who told me that they were prescribed a antidepressant because and she was in her transition period and had a injury from that and is now having a really hard time getting off of that medication. I mean, so it's more severe than just saying, "Oh, they prescribed an SSRI." Like these could be very damaging to people. Well, let's try not to go that route and see if there's a couple of other ways to try to handle these situations.
Yeah, with SSRIs, and there's a few different psychiatric meds where the body can get very accustomed to those medicines. And so to taper off of them can be quite challenging because the individual can go through withdrawal. So it's not that when they stop the medicine, it's not that their anxiety, depression came back, it's that their body's actually withdrawing from the medication. And so you typically have to taper these much more slowly. Oftentimes I like using the liquid preparations so you really can taper them slowly. But that was actually not something we were trained. We were trained, cut the dose 50%, 50% maybe, and then just stop it. And if you stop someone suddenly on these types of medicines, that really, for some people, can just throw the body for a huge loop that can be horribly uncomfortable. And yeah.
It can be quite devastating to be honest. Like worse than just having like the depressive symptoms in the first place from losing the estrogen. It's
Yeah.
I mean, it can be very devastating. So
Yeah.
definitely something that if your standard doctor is not having that conversation with you, something to look into before saying yes to that particular treatment. Go seek some other advice would be my uneducated recommendation. But I have seen I'm not in the medical space, but I've seen that myself, and it's heart-wrenching. Honestly, it's heart-wrenching that
Yeah.
women are treated in that way. Like we're humans too. Like
Yeah.
care
Yeah,
about us just a little bit.
there's another thing that I think is unfortunately not discussed or not brought up as much in women's healthcare because it's not necessarily a comfortable topic for women to bring up, and then if the provider's not asking about it, but that is the genitourinary syndrome of menopause. And so some women, most women will actually, again, with postmenopause or even sometimes during perimenopause, can develop vaginal itching, dryness, pain with sexual activity, urinary symptoms that can be it could be recurrent UTIs, it could be yeast infections, it could just be that urgency or that frequency that they really have to go often, making them wake up a lot in the middle of the night. And that can all be quite disruptive, you could imagine, and sometimes be really, really hard on a relationship for everybody. And there is a study that looked at over 77 women out of 100 will have these symptoms. Maybe 25 will actually bring them up to the provider to, let them know what's going on. And then only 7 of those women will actually get offered something for treatment. And I mean, for the 25 who actually bring it up, the treatment is for the most part, so easy. Vaginal estrogen, it is so effective. You do not typically get systemic level dosing, so you don't really have to worry about side effects. You don't have to worry about complications from it. Even in women who have breast cancer, you can use vaginal estrogen, talk to the oncologist, but it's been shown safe in numerous studies. And so there's really no reason not to prescribe it if someone is having any symptoms. And I think it's just, again, something that needs to change from an educational standpoint. There is just last year a study on recurrent UTIs. Over 1 million women were looked at with recurrent UTIs. And if you used vaginal estrogen, they compared 2 groups. One didn't have any. There is a lower risk of sepsis, which is being admitted to the hospital with urosepsis. If you've heard of that, it's going to be very serious. You're in the intensive care unit. So there's a lower risk of that, lower risk of any hospitalization, and a lower risk of mortality. There's not a lot of things that can actually lower mortality risk when you look from a medication standpoint. And so that's pretty amazing. So definitely something I think, again, worth bringing up if you haven't had that discussion, or if it's someone, if someone's having symptoms. Sometimes the systemic hormones actually treat that very well, but sometimes you actually do need both. And so, again, just something to kind of think about. And it's not a taboo topic. It's most women, right? Over 70 out of 100 women are dealing with some kind of symptoms after menopause. So it just needs to be discussed more.
Yeah, I agree, and I'm really happy that you brought it up, because I have been trying to have these open conversations with a lot of the guests that I've had on. Is that, it's on us too. Like, we do think it's taboo. We don't want to talk about it. We don't feel 100% comfortable with our caregiver, so we keep it back. But it's information that everybody, that they, you have to initiate the conversation
Yeah.
sometimes, but would be nice to have the questions. Like, if there's a little list of questions that the doctors ask, if they could just include that on there, maybe make it more comfortable. Like, it's a gift, like we can meet in the middle somewhere
Yeah.
with that conversation. And I like that you brought it up too, because I don't think people understand that that's an option. Like, I think they only think of like this pill version or this patch version, and there's
Yeah.
other options available.
Yeah, for sure.
And also, you had mentioned like the joint pain. Like, I know for myself, that's been a big thing. Like, I went through all of this. Oh, you're injured from working out. Have all these scans done. They don't find any injury. They don't find any arthritis. And I have this joint pain. I can't explain it. It comes, it goes. And finally reading a book and being like, oh, it's a hormonal thing. Like, why aren't we talking about this? The
Yeah.
ladies need to know that you can get all kinds of crazy, weird symptoms that don't add up or match up. Like, we got to talk about it.
Yeah, that's a great. So it's now called. It actually is a name it didn't before, but musculoskeletal syndrome of menopause, and that's because it's one of the most common symptoms women actually have, and over 20% of women say it's the most severe symptom they actually have. The joint pains, they can be terrible, and what's awesome is that hormone therapy, not for everybody, but for a lot of people, it gets so much better. And you may be surprised sometimes. I had a 68-year-old woman who we put her on a very low dose estrogen, and her joint pains got way better. I honestly did not even expect that, because at 68, I thought, maybe it's less likely hormonally related, but they did. And so estrogen, it's like a joint lubricant, and it does so many different things in the body. But I've had now, I can't tell you how many patients who have had similar and said, yeah, my joint pains are doing better. I've had frozen shoulders start getting better, plantar fasciitis resolve. So just there's a questionnaire called the Menopause Rating Scale, and I like to have people complete that, because that asks about 13 different questions that all these different symptoms that you may not associate with menopause, that is actually, again, could really be related to the hormone fluctuations. So it's, or 11 questions. So it's hot flashes, heart discomfort. So palpitations, that's another something that can actually be very common during perimenopause. Sleep issues, probably one of the most common things. Anxiety, depressive type symptoms, or just more irritability. There's more with some of the hormone swings, especially, that can create more irritable or labile emotions. Then, there's the sexual symptoms, bladder symptoms, vaginal symptoms, and then joint and muscular. So all of those, really, truly, there's an interplay with hormones, and not just estrogen and progesterone, but for women, testosterone also is a very important hormone. It's not just a male hormone. In fact, women have more testosterone than estrogen for a large part of the cycle, most of it. So that's just another thing not to kind of forget about when you're looking at the whole picture.
And there's that whole feeling, there's this feeling, like this anxiety, we were talking about women being put on an SSRI, like, get that, like, it makes sense. Like, all this weird, wacky, what you're used to, these normal levels are just going all over the place. Of course, that's going to make you get all freaked out. Like, there's stuff that you can't explain. It's not an easy process, but you got to go through it. So might as well, look into some of the options that are available, eating right, perhaps adding in some hormone, doing these things to just make that transition just even so slightly more comfortable than crazy match, one light after the other, hot flashes and not sleeping and being grouchy all the time. Like, there's a better way, ladies. I just want you to know there's a better way. So
Yeah.
if somebody can't see Dr. Laura, what would be good advice? How could we kind of direct the ladies in the right direction?
Yeah. So on the Menopause Society's website, they actually have a practitioner list. So they will, they can look up in their state, or have they gone through the Menopause Society certification process. And so that's, I think, a really good reference. And then just, you mentioned you've read books, and I think getting that education is really helpful. It empowers you if you have that background. There are some really good podcasts now too. Rachel Rubin has done some good podcasts. She's a urologist. Dr. Mary Claire Havers, she's published now 2 different books. Kristen Johnson published a book, The Great Menopause Myth. And, those are some great reads as well to just empower you about how hormones are used in the body and how important they are too.
Wow. I could continue talking about this for a while, but there's another reason why you're here. And you just said book. So let's just use that as our transition. So you've
love
written, I'm so good. I'm super professional. But you've written a book, and it just recently came out like a month ago. And guys, it's not like a super huge book. I'll hold it up for those who are watching. This is a hardback. It's it's called Make It Be So. Now, you may be expecting, I turned around from my microwave phone. You may be expecting a book about all of what we just discussed, because clearly Dr. Laura is extremely smart and can pull all of these great studies out and will research things, come back with information for you, the patient, to go through and decide and make an educated decision with your doctor. She can do that. But she's also gone through quite a year and a half, trying to explain the unexplainable, I think would be the best way to describe that. Earlier, you said there was a series of events and you looked at them one way, and now you look at them a different way. Tell us more.
So I start back and kind of my journey and go through. Actually, I can go through if you'd like the process, but I'll jump to the takeaway. So Eric Westman, I'm actually going to use this. I was just thinking about this. I mentioned when it comes to metabolic health and ketogenic diets, what you can see in the amount of things that get better, it's so unbelievable. It's unbelievable. Well, I had that same thing happening, but it was not from exactly the medical, but more in spiritual. Unfolding in every way in front of my life, actually. That there was just so many unbelievable things happening that instead of calling things coincidences, I said they are now God incidents. And so I ask if someone's listening to the first time, they are like, wait, what, this big transition. Now we're talking about metabolic health. Now we're talking about God. I just ask you to be less stubborn than I was. Stay open, because that is definitely my takeaway, from the book is stay open, be less stubborn, stop dismissing whatever it is that you don't initially understand, or just calling things coincidences over and over and over. And that's why I wrote the book, which I had zero intentions of ever writing a book, but I just started writing down the stories that were happening in my life because I was amazed over and over. And I wanted to share it with my family. That was the big reason. I wanted it for myself to read it again, to be like, yeah, this really did happen. And then to share it with my brothers and my parents. And so I'll go through kind of just some of these amazing things that really, again, kind of why I wrote the book. So in 2024, my granny, who she's, again, the one who aged successfully, kind of inspired things, she passed, and she lived on Anna Maria Island. And for 35 years, her house never got hardly any hurricane damage, was protected. And she said she had a guardian angel that protected her. And that's why it never happened. That year after she passed, it got hit and destroyed almost by 3 hurricanes. And I couldn't believe it. I was like, 35 years, there's not a single hurricane. She passes that year, it just gets wrecked. And so I was like, maybe there's something to this guardian angel after all. And so my parents, they're both very strong Christians. And, but I was not a Christian. I was agnostic, and I had been for, decades. And so I just prayed a very simple prayer. God, if you are real, please show me you are real. And I was very skeptical, but I prayed it a lot. I prayed it almost every night. And a year later, on the anniversary of her passing, I had a really interesting dream. And this was the first coincidence that was really unexplainable. And I was tossing and turning in both real life and the dream. It was terrible night's sleep, and I was sleeping in the dream in her Anna Maria Island house. And my husband was coming back from the bathroom, and I woke up and said, "Hey, what time is it?" He said, "It's 4:31." I said, "Oh, great. That's early enough. I can get out of bed." So I got out of bed, walked into the other room, and she walked in, my granny, and she was dancing. She wasn't paralyzed anymore, and it was wonderful and happy. And then in real life, I woke up again for the umpteenth time, and my husband was walking back from the bathroom, and I said, "Matt, what time is it?" And he said, 4:31. And I was, "Wait, what did you just say?" I couldn't believe it. And I immediately told him the dream. We went back to bed. And in the morning time, I still was kind of like, I don't think that really happened. So I said, "Hey, did you wake up at 4:31 last night?" And he told me, he's like, "Yeah, that really happened. You told me about it." And I was like, "Okay, so I'm not losing it." And so that was just the one of, many things that happened. So I was like, okay, again, still thinking, is there some other possible way to explain that? But I don't think there's a great way. And then in April, I had a friend invite me to church. And again, I hadn't been into church for a very long time. It was Easter service. And so I was like, okay, sure, I'll go for the social aspect. And we went, and then I continued to go with her on Sundays. And just a few weeks going to church, I was sitting there, same thing, like, "Lord, please show me you're real." And I was just hit with this fire sensation, like I can't describe it truly what it felt like, but my head was on fire, my chest was on fire. I couldn't breathe, but I wasn't panicking that I couldn't breathe. And tears were streaming, and I was thinking, is this like a panic attack? Am I hyperventilating? Is it hormones? Is there, trying to analyze it? Like
you can't not doctor in these moments, right? Yeah.
Exactly. Yep. Exactly. So I'm just going through the whole list. Meanwhile, I'm totally overwhelmed. And I'm like, now I'll use the term Holy Spirit, but I really didn't have a term for it when that happened. But I went home and I told Matt, and Matt, I won't go too much into his own story, but he also had a very cool, we kind of happened to come on this journey together. And then my parents, they had been sending me videos of healings and just some pretty cool stories of people either finding God or, different things happening. And so one of them they sent me was on someone named Alyssa Whitson, who was healed of Ehlers-Danlos syndrome, which is genetic. You have, she had 16 surgeries on multiple different joints. She had braces all over her joints because with Ehlers-Danlos syndrome, it's a connective tissue disorder. So joints can just dislocate spontaneously. Her hip would actually dislocate while she was sleeping. Sometimes her knees would dislocate. So incredibly painful. Again, as you can imagine, 16 surgeries. And she was having trouble raising her arms to 90 degrees and raising her legs. And she had, again, joints, braces from her hips down. And she, one night, was prayed for, and she had been prayed for many times before this, but she was prayed for, and that night she was running around the church, miraculous healing, arms raised above her head, legs. And I said, okay, hold on. Like, there's no way, right? She's got to be lying, or this is a miracle. And this goes back to, not being able to explain everything in the natural. And she's got the pictures, and I said, okay, what I'm going to do here, I want to take it from my data standpoint. I want to write this case report. I want to look at the medical records and see, did she have 16 surgeries? And then did she all of a sudden be able to run, and when before she could, she struggled to walk or raise her arms. And so that was just my, as soon as I heard it, all these different thoughts going into my head. But then, watching the videos, and she's got all the pictures of the braces, I was like, it's a miracle, right? It's a miracle. And I don't think she's lying. Well, this is where I think God steps in again so I've just have this in my imagination. I was like, all right, I've got to figure out some way to write this case report at some point. And my parents go to a conference 2 months later in California, and they meet someone at the conference and they become friends with this individual. And then 2 days after they're friends with this person, they realize, oh my gosh, this is Alyssa Whitson that was healed in that video we sent Laura 2 months ago. And they told her, and they said, hey, Laura wants to write your case report, but, will you just talk to her? And so we got on a Zoom call, and we actually spoke for 2 hours, and it was an amazing Zoom call. And her story, it was real. She did have this miraculous healing. And I mean, her heart was changed, everything. Like, it was amazing. And so that Zoom call was actually, I was born again that day. And I think she just really opened my eyes to, I was having a lot of these kind of intrusive or negative thoughts and trying to resist, fight a little bit God and say, if I'm so analytical, I want the evidence very clear in front of my face, but I think there are some things you can't explain, and that's okay. And that's, faith, trust in God, and it's okay. Faith, in part, you accept the things you may not be able to explain. And then it gets a little bit even more mind-blowing. So that's happened, and life continued and was great. But she helped get away some of those negative thoughts in my head about things I wasn't made for this. But that, God really, had already placed me where he wanted me. And I was, the way Matt and I met, and which is, it's just the way Tro and I met, all these different things, it was so perfect. The people that I've been connected with, and just feel very blessed in that way. So 2 months later, we'd stay in touch with each other. 2 months later, she texted me and said, hey, I'm going to be interviewed for this TV show called Miracle. And it's a show where they look at medically documented miracles, and they review the medical records, and they really analyze it. And then it's on Angel Studios. And so they may want to reach out to you to get your medical input or opinion on the matter. And so I said, oh, that's cool. That's awesome. Also a little terrified, stepping out from my physician persona to talking about miracles. And I'm just very, very brand new to my faith in general. But I was like, God, if I'm meant to do this, like, please give me a bright, obvious sign, because this feels very uncomfortable. And so just 5 days later at church, I just, go to small church here in my town in Winston-Salem. And after worship, our pastor calls up someone named Kimberly to the stage. And he says, Kimberly, do you mind just telling people what you do for a living? And Kimberly says, I'm the producer of a TV show called Miracle. And Matt and I looked at each other. No way, right? Like, this is you can't make that up. It's like, we go to a small little church here in Winston. The show is produced in California. They fly all over the country. And here, 5 days later after this text, was the producer of that show at our church. And so I went up to her after church and I said, hey, what got you to get called to the stage today? And she had no idea. I asked her if she knew Alyssa. She actually had no idea who Alyssa was. That was a separate, they have departments that look for different people to, as far as healings go. And so it was a God incident. And and there's many more just amazing things that he continues to show up in our lives. And I go through a lot more examples in the book that he slowly and graciously kind of led me through, because I did want to keep on doubting, or did resist, or I was very stubborn. And I still, throughout my stubbornness, I still kept that prayer of like, please keep showing me. and he did, and he, yeah, I feel blessed on that. And so the book, it's really not about leaving science. It's not a lot about leaving medicine, because I truly am heavily, like you said, I love the stats. I love the evidence base. But it's really about that journey and finding God, who actually created both of these things. And yeah, so it's,
Yeah.
yeah, yeah,
Yeah.
it's,
Yeah. I mean, I found it refreshing. I find it refreshing, actually. There's a lot of people, doctors in, especially because I'm in the metabolic health space, but maybe it's more universal than that. But there's so many doctors who are very open about their faith. And I think that is a refreshing thing. Like, it doesn't have to be one or the other, they can live simultaneously. And I think you do a really good job of speaking to that struggle because you lived it in this book. And you guys, there's more coincidences, God incidences in the actual storytelling of the book. And I think you did a great job of outlining your journey from this kind of skeptic to this believer, and how it's changed your practice. You kind of outline that in there as well. It's been hugely beneficial towards you, and it's good to embrace it and speak openly about it.
yeah, thank you. Yeah, it is, our church, they put this in there, but the tagline is "No God, Take Action." And so, I'm slowly building up and working in that faith. And I think the synergism, like the connection between, again, medicine and faith together, is just, it's really good.
Well, and you started this story talking about how you wanted to heal. You saw what was going on with your granny, and you saw what was going on with your grandfather, and you were like, I want to get into medicine to heal people so that they can live a full life like my granny did. And here she shows up again in your life after she passes to remind you how to keep doing that. And I think it's just an amazing thing. The story about your daughter's connection to all of that is pretty cool. I won't give it away, you got to read the book. But it's amazing. And that you took the time to kind of reflect on it and realize what was going on. I think a lot of people would just blow through it, like you said, and just say it's a coincidence. Or you talked about the Apple Watch and all the circles, like it's just filling another circle or whatever. But I do firmly believe, when you open yourself up, things start to happen. It's when
Yeah.
you're really like, oh no, I've got to explain all these things, that you limit yourself by doing that. So opening yourself up really changes everything.
Yeah, yeah, exactly.
So, well, I appreciate you telling that. Just real quick, we have just a little bit of almost, we've hit time, but just real quick, how has it changed your practice?
So I think, for some patients, there has been some really great times where we've just been able to pray together about their condition or about what's going on. And that has added, I really do believe, an extra connection, but an extra level of care. And even the patients that I'm not necessarily praying for together, like we're not praying during the clinic visit. Matt and I, we pray for our patients at nighttime, and we also help, asking for guidance and how we can, best help people. Again, we live very blessed lives, and so we want to, pass that blessing on as much as we can. And I think there's been just a few different, really like powerful encounters or conversations with patients that have happened since then. And now even growing and talking to more people in our community. And now we're actually going to be joining something over at our residency to talk to future residents about faith, and even potentially medical students. And so the hope being, again, maybe there's something that is more, people are more open to going forward, similar to the low carb.
Yeah, exactly. I mean, it's really not that different, is it? You're kind of having to do a brain shift here. Like, it's okay to talk about these things.
Yeah, exactly. And I think, I think I have seen a few miracles that God has helped some patients out. And I mean, God has done a whole lot more, but God, he has healed them. Um, and we keep on praying for some other miracles. There's there's a lot of, unfortunately, I think a lot of cancer and a lot of different, metabolic, again, partially metabolically related, but that is going on right now. And so we keep going the medical route, but keep the spiritual route alongside that. I actually had, this is just another example of, I think, God showing up in our lives, but it's someone who recently had a diagnosis of colon cancer at a young age and has to get a part of their colon removed. And when they showed up to the surgery unit, the very first thing, the first lady at the opening desk, she had a Bible verse on her name tag. And then the next nurse that was doing kind of the next steps into anesthesia, she asked if she could pray with them. And then the surgeon came in, and before they went to the OR, asked if he could pray with them. And just saying, hey, I'm here every step of the way. It's good. It's like you said, stay open. And you'll start noticing and seeing so much more. The stories that I have now heard from other people, now that I've been open to talking about this, and other people then kind of share what they have, is remarkable. It's almost like a domino effect. Once you hear it, and then the next person, and it's amazing.
I think there's a lot of room for God here. I still think that there's a lot of people who still don't feel like they're believers. But I think no matter what, having hope changes everything. So even if it's not a faith belief in God, if you lose hope, suddenly the dominoes start to fall. So having hope in some capacity, a prayer. I was on a flight recently, and the flight attendant was like, this may not resonate with you, but I'm going to say it anyway. Me and my wife pray for everyone on all of my flights so that we can have a safe journey. And it does, it feels good. Even if it's not something that you particularly do, it feels good to know that somebody's thinking about you in that way. And it's good to know that that's happening in medicine as well. And I really do appreciate that you've been very open about this journey for yourself, for your family, and thankful for all the other doctors out there who are doing the same thing. It's helpful for everyone. I think it's helpful for everyone. Even if it doesn't particularly resonate, it still instills that hope that gets so easily lost, especially in the most sick times.
Absolutely. I think you said that perfectly. I'm not going to add to it.
Period. The end. I did it. No. Well, it's been such a pleasure to have you here today for this conversation. I'm sure we could have talked and talked and talked and talked, but you're a busy mom and a busy physician and all of that thing. So I just appreciate that you took a little bit of time out today to skim over all of the basics, because I'm sure this could go much, much deeper. But I appreciate you and all the work you're doing. And before we go, where can people find you?
Yeah, so I'm on X at Buchanan MD, although much, much less active now that I have 2 kids. And I'm also at Tro.health. So that's our main company website, and currently accepting patients. We're licensed in almost all 50 states. So we'd love to see you, help you on your metabolic health or hormonal journey, which, really that's very intertwined. But would love to see you.
The practice of metabolic health, it's a full body care situation. You're not going to one doctor and saying, we're going to talk about this, and then another doctor and we're talking about this. It's full body, all encompassing. And if you need a specialist, what's amazing and what I've learned with Dr. Tro's practice that's now Toward Health is that the team gets involved. So if you go to someone that's local to you because Toward Health has sent you there, the team, if there's a miscommunication or anything, the office staff, everybody involved will jump in and advocate for the best experience for you. So, as a patient myself, I truly appreciate that, because in those times, that's when I get a little mealy and don't want to speak up for myself. So the team definitely comes in and does that for you. So it's a good, I've had issues with medication that they're like, don't worry, we'll handle it for you. So it's a relief all around to have somebody who understands why I have to eat the way I eat, or metabolic health in general, but then to also have a team behind it that will keep pushing it forward. It's an amazing thing. So if you can, go to Toward Health. They're great physicians there, especially if they're in your licensed in your area. And if not, I'm sure the team can help you find somebody, because it's a really good team. So anyway, I can't speak enough about it. And again, I appreciate you taking the time to join me here on Ketobiography. Thank you so much for being so open about your story. It's important to put that out there. And I love that you sat down and kind of journaled it out in this book for everybody to follow along with, and keep doing what you're doing. You're doing amazing things.
Thank you so much. It was my pleasure and wonderful to talk with you. And thank you for bringing up the book. And yeah, thank you.
What an amazing year and it's been, and just so many more to follow. So again, on behalf of Dr. Laura Buchanan, I'm Robyn Dobbins. Thank you for hearing our Ketobiography. Bye.